Okay, Dr. Naresh. Hello, am I audible? Hello.
Yes, ma'am, you are audible.
You're audible. You're audible, doctor.
I'm audible.
So, yes, yes, you are audible also.
And
Now we
now
are
web.
starting from clinical.
Yeah, just a minute. Just a minute. I can just mute this. Yeah, please. Thank you so much. Am I audible?
Hmm. Yes, you are audible. No problem.
Mm-hmm.
So, first of all, you enter the room. I am telling you, do a general examination of a child.
Okay. Yeah, I entered the room. I'll say good morning to my examiner. I'll like to hand over my assessment sheet to examiner. Like I'm Dr. Naresh, and this is my assessment sheet for this clinical station. Then
Okay.
my command is
Thank
general
you.
physical examination, and I'll
Mhm.
go in front of the patient. How old the patient is,
She is 5 years age old.
and
Sarah.
what Sarah? Okay, hello Sarah. Good morning. How are you doing?
Smiling. She's smiling, playing, running.
Okay, okay, that's good. And who is accompanied with the Sarah?
Mother Fatima.
Okay. Hello, Mrs. Fatima. I am Dr. Naresh. I am one of the exam candidate for this exam, and I'm going to examine this Sarah from head to toe. Is it okay with you?
Yes, it's okay.
Okay, thank you so much. So, does the Sarah look any unusual features?
No, that is
Okay.
noticeable any unusual features
And what
on
about
her.
her? What about her dimensions in terms of the weight, height, and head circumference?
She is small from her age.
Can you please let me know exact centiles of the small?
Little small, not centers I have take.
So she's a small.
Mm.
Okay. What about her weight?
Weight okay. five
Okay.
years
Any
age old.
what about the head circumference?
Head circumference is more. There is some prominence of the forehead.
Okay. And can you please let me know is there any devices around?
No, there is no any devices.
Does Sarah ill looking or well looking? Because she's walking and running, that means actually she's well looking.
She looking well.
Okay. Is there any hearing aid or any specs?
No, there is no hearing aid or specs.
Can Sarah walk?
She walk, but her leg has some deformity, like bowing present.
Going present. Okay. Okay. Then I will like to basically take at this point of a time, I would like to take the Sarah in front of my examination from this actually short. She's having the bowing leg. So is any other deformity in the front?
No, no deformity.
Any asymmetry?
No, but
Any
her gait is some kind of waddling type gait.
okay. Okay, okay. Then I'd like to take Sarah on this couch, and then I would like to take this permission for the exposure of Sarah from head to toe. So as you said,
Okay.
the head is
Hmm.
having the head prominence. What about if there's any bossing of the head?
Yes, it is a box shaped head,
Okay,
frontal bossing.
okay. Can you please let me about eyes?
Eyes is okay.
Any ear abnormalities?
No,
Any nose problem? Nose?
no,
Any nasal
no,
septum? What about the
no.
mouth?
Mouth, inside mouth, some kind of dental crowding present.
Okay. And can you please let me know about the faces of the Sarah?
Face is
Faces,
normal.
normal. And what about the anemia or this jaundice in eyes?
No, there is no any anemia or jaundice.
Okay. And then I will go down. Is what about the thyroid? Is there any swelling? Sorry, is there any swelling in the neck?
No, there is no any swelling in the neck.
Okay. And the chest, is there any abnormality which is visible in the chest, like from the rachitic rosary or pectus excavatum or pectus excavatum?
The shape of the chest is actually pigeon shaped.
Pigeon shape. Any rachitic rosary?
Yes,
Okay. What about the protuberant of abdomen? Abdomen is protuberant?
some kind of.
Okay. Then I like to take the Sarah's this hands. I'll ask Sarah, can you stretch hands for me? Is there any clubbing?
No, there is no any clapping.
Okay. And what about this the lower this radioulnar joint? Is it
Radio ulna, some kind of widening present.
widening present? Okay. And is there is any marks over the skin?
No, there is no any skin marks.
Okay, as you said, there's in lower legs, she's having a bowing. Am I right?
Hmm.
Is
Yes.
there is there anything like arches difficulty like planus or this cavus?
Yes, there is some kind of pes planus present.
Okay, and then I'd like to basically see the back of the Sarah. Is there any scoliosis?
Yes, scoliosis present.
Okay, is there any scar, any rash over the back?
No, there is no rash or scar.
Okay, then I will like to, yeah, this is my examination so far, and then I will like to basically take her vitals in the form of pulse and respiratory rate. Can you please let me know?
Hmm. Also, it's normal. Respiratory rate also normal. No
Pulse,
deformity.
okay, okay, and any lumps and bumps, I would like to basically look for this, uh, this examine of this lymph nodes.
No, there is no any lymph nodes.
Okay, is there any edema over the legs?
No, there is no any edema of the legs.
Okay. So this, what about the mentality of the Sarah is good because she's talking to me.
Yes, yes. Mentality
O-
is normal.
Okay, that completes my general physical examination for today. So I examined Sarah. She's a 5-year-old girl, and when actually I examined, and she's having this unusual features in the form of the frontal bossing, but that's not exactly the unusual feature. And she's short for her age, and when she walks, she's having the bored legs, and she typically having the waddling gait. And after that, actually, I took the Sarah on a couch. I found the only positive finding which I found, there's a rachitic rosary, there's a protrusion of abdomen, there is a this widening of the radial ulnar joint, and
Mhm.
yeah, this is my examination, and there is cholesterol also. So if I assimilate my
Explain
all
us
the
also.
is my estimate by all the findings, actually she's having short with all the estimate, my diagnosis goes towards the rickets.
Yes. What investigation you want to do?
I would like to investigate. I would like to basically manage Sarah in form of like general all complete history and examination. Then like to plot his weight and height and appropriate growth chart. Like take his vitals, including saturation, including the BP also, and then like to investigate in the form of my first investigation. I will go for the complete blood count to look for anemia, and then I would like to basically go for the serum calcium, serum phosphorus, PTH, and 25 OHD3 and X-ray of the non-dominant hand, that is AP and lateral view.
Okay.
And I
And
like to look at the urine also, urine for this if I'm thinking in terms of like hypophosphatidemics, but not
uh,
right now.
treatment, what you give?
I will
Medications?
Once actually I did my all the investigations done, I would like to involve my consultant. I would like to involve the orthopedician. I would like to involve this psychotherapist. So I would like to give the treatment in the form of the vitamin D. I would like to give the loading dose of vitamin D, and then I like to give the maintenance dose of vitamin D every day with calcium.
Any
And
advice?
I would like to give advice if between April and October month, she's supposed to be in the sunshine at least for 10 minutes every day between 11 to 3 p.m. And second thing, I would like to go for this thing, vitamin D rich food like in the form of egg yolk and then mushrooms and then ghee, butter and all. I don't know what is it ghee is called in English.
Cheese is cheese.
Cheese, yeah, cheese, yeah, cheese, butter, egg yolk, and this
Okay.
mushrooms and all I like to buy.
Okay. So nice. Everything you nicely tell, but you forgot to wash and ask that if
Oh,
any point pain, please inform me. That is our okay
always,
beginning.
I always forget about the washing. I don't know why.
Mm. No, no. I think the similar mistake everyone do. I've seen like
Mm,
puberty during history time, missing puberty.
right.
If she is on 11 years age old, we of course do ask the boy or girl the puberty. From 9
Mm,
years to actually 10 staging.
yeah.
So okay. So thank you for your participation. So generally, how rickets patient we find short proportionate or disproportionate, not obese, maybe faltered growth, normal mentality. If that is except the Sanjat Sakati, plus minus syndromic features and normal puberty. General look. And on head we find 4B and 4D. 4B is that box shaped head, dolichocephaly, increase the anterior posterior diameter. Frontal bossing, bone softening, there is craniotapes if started before 1 year, and alopecia totalis. 4D, that is delayed dentition, delayed dental caries, dental crowding, delayed closure of fontanelle if started before 1 year. And the upper limb, what we find, that is also 4B, like bowing, we find pathological fracture, angulation or callus formation, broadening and splanus. And chest, what we find, Harrison sulcus plus pectus carinatum or pectus excavatum, that is pigeon-shaped chest, rachitic rosary beads and ptosis of the liver and spleen. Gait and back, we find gait and back, waddling gait, scoliosis, hypermobility, there is Brighton score we can do. And investigation, what we do as clinical fast, we tell the diagnostic, that is bone profile, we do the calcium phosphate, vitamin D, alkaline phosphatase, and parathyroid hormone, and genetics testing for the type. Lab urea and electrolyte, renal function test, malabsorptions, celiac. Imaging, we do the X-ray wrist, and it is important finding we find widening of the epiphyseal plate, decrease the bone density, fraying, cupping, increase joint space, and green stick fracture. Investigation for complication, we do the renal function test, full blood count, iron profile, if caused by renal disease. And treatment, vitamin D supplementation and the advice given. So our clinical IQ covered. Next, what we do?
Hello.
Yes,
Hello,
I'm here.
Dr. Emma. I have just one doubt. Uh, is RNB supposed to do the short stature maneuvers?
They are telling that for complication, searching complication, we do that.
Okay.
Like
Okay,
investigation for complication, do we renal function test, full blood count, and iron profile, if caused by renal disease, because renal disease is one of the cause of rickets.
Okay.
mount
That is
disease is
last. I think not if you miss that, no problem. We diagnostic the bone profile is important here, and X-ray of the wrist. These are important.
and a closest
Okay.
differential is mount disease.
Okay, next what we practice?